Okay, Leanne, how much sleep do you think you get?
I know it's a rhetorical question. Not enough.
Yeah.
So in today's Health Matters with TSET, health coach Dottie Small learns the short and long-term effects that we face if we don't get enough good sleep.
If you could narrow in on one thing, what would you say is the foundation of good health?
If you don't have good sleep and good stress control, whatever your lot in life is, there is some stress. So it's our response to that and our sleep. If you can't get somebody's sleep right, it's really hard to do other things and really move the needle.
Why is sleep so important to our health?
It's really multifaceted, right? You have the lymphatic system, there's relationship to poor sleep and brain health, and then dementia. You take somebody and you impact their sleep in a negative way, it impacts their hormones, it impacts the way their body responds as far as insulin response. Whenever we get good deep sleep, good restorative sleep, our brain really cleans itself out, takes out the trash, so to speak.
What can people expect to experience if they don't set themselves up for a good night's sleep? Not just one night, but over a long period of time.
A shortened lifespan. All the other things that lead to chronic disease that end up leading to our demise and making life a hassle in the last 10 years of life, it'll contribute to all of those things. So sleep is one of the biggest things that's not addressed in the general population.
What are some small but effective ways people can start to improve their sleep?
One of the things that people have problems with is they might go to bed fine, and then they'll wake up and they'll ruminate. Their brain will just chew on different things throughout the night, and they'll wake them up at like 1, 2 in the morning, and they can't go back to sleep. So one of the tricks that I have that I talk to our patients about that is cheap and anybody can do, and actually won't cost you a dime, is some specific breath work. And it's kind of in 3 parts. The first part is the 4-7-8 breathing. There's a lot of literature around this where you breathe in for 4 seconds and you hold for 7, and then you breathe out your mouth for 8. And you do that about 4 to 5 times. And then after that, you think about 3 things you're thankful for. And that's it. It's impossible or very difficult to be anxious whenever you're in a grateful state. So if we can shift somebody from an anxious state by redirecting towards the breath and then redirecting towards gratefulness, 9 times out of 10, the next thing you remember is you're waking up in the morning.